So in the back is really where most of the action happens for the patient, and I'll just show you a bit of what we've got. So there are 2 seats in the back here, one here, that's usually for the doctor or paramedic, and there's another one here. Now there's only 2 of us on the crew today, so we've got a piece of kit on that chair there because it makes it more accessible and easier to get to. You'll see as I climb in, it's a little bit cramped, but on this trolley here we've got our bags, our kit bags. I can pull them out a little bit to show you a bit more. So if we look down there, you can see that we've got a whole trolley full of kit. And in this is pretty much everything you'd find in an emergency department. So we can do pretty much any procedure that you would have done in hospital, but we can do it by the roadside, in the field, wherever you might find us. You'll notice we've got monitoring. So that's a proper monitor that can do all the bits and pieces that we need, including defibrillation and pacing. On the side, we've got some suction in case the patient has stuff in their airway. Down here, we've got some headsets, but that's for the patient who's awake. It helps muffle the sound a little bit. And also if they want to, they can hear what we're saying as we talk, because we're of course all wearing headsets. Now, where does the patient go if we have to fly them? Well, remember that a lot of our patients don't need to be flown. We take them by land because it's either quicker, or we just need access to get through to the patient. But if we do need to fly them, then we move all of these bags off and we sneak them down into this little spot here. Now, the other thing that can then happen is this seat here, which is for the paramedic or the technical crew member, that can turn round so they're facing back into the cockpit, into the back of the helicopter here. And we've got a bit of space down there that we can also use for those bags. It does get a bit of a tight squeeze, and that's why sometimes we choose to take people in an ambulance, and often we can't take other people with us. Although if it was a child, we'd really try and take their parents with us.